morning. Today I'm going to talk about an ethic case study. This is for the lab class in Trends and Issues in Nutrition. My name is Jenny. So, so this is the scenario that we have in this case. It's a old woman that has been tube feeding via IV, and she's tired of the tube feeding that she already has. But her daughter is concerned because her mom has a severe dementia, and she's worried that in what time she's going to not remember to eat or drink at all, and it will be bad for her health. No? So the clinician asked her about if she already have an advance directive. When the older woman answered that she doesn't believe in those things, so it makes kind of hard to make a decision as a health provider because of her severe dementia. As we know, dementia, it's a mental illness that is progressive, and at the end the patient forget even how to drink water, chew food. She forgets, and sometimes those patients just depressed, and you know what happened next, no, with the patient. So as a health providers, we have a code of ethics. This code of ethics applies to nutrition and dietetics practitioners who can act wide variety of capacities. In this case, it will apply to Ms. Sweet because it provides general principles and specific ethical standards for her situation. That way, we can protect ourselves and protect the patients for any misleading or misunderstanding with them. As a dietitian, we should explain to the patient the consequences that it will cause if the tube is removed and how her condition can deteriorate in short time because of her dementia. In this case, the code of ethics that that it's there is the beneficence. Beneficence is an encompass taking positive steps to benefit others, which includes balancing benefits and risk. So, in this part of the presentation is when we most explain to the patient what the consequence that she probably has with her illness. As I mentioned before, as a healthcare providers, we must explain what is an advance directive. First of all, we need to explain to her again that the advance directive is where patients have the right to give instructions about their own health and have the right to name someone else make her healthcare decision for them. It will be beneficial if she can help us to sign this paper because when her dementia goes in advance, we need to take decisions and we can make decisions on our own. It will be great if she put her daughter that she manifests that she's taking care of her and she's worried about the health of her mother. If I was a RDN in this situation, I will respond by saying to Miss Sweet, I know it's difficult to be with parental tube feeding. In this case, that's why she's complaining about the bag and the IV. Unfortunately, based on the studies, more dementias are progress, and your daughter has a strong point about foods and liquids. I will be worried about the patient, and I will show to her that I care of her because, first of all, it's my patient. I have a care provider. So for me, it's really important that the patient understand the situation and what will be the the worst to her. What will happen if we just remove the tube, and what will happen if she just stop eating, etc. As I mentioned before in the past slide, I will explain to the patient the consequences on her body, on what will we happen if she stops eating. If I will say if she lose interest on stop eating and drinking, her strength will be lower and weaker. And most of the time, these patients suffer a lot of depression, so they don't have energy. They must want to be sleeping, or they can do a lot because they don't have the sufficient energy to make the basic stuff like talk. They forgot to talk, but it will be quicker if her health is not getting in the pathway that we just want her. So if the patient refuses to sign an advance directive, as I mentioned before, as a dietitian, we must start finding another way to feed her. For example, if she really refuses to get the parental feeding, I will change her diet a little bit just to try to cooperate with her and give her a small portions of food. Most of the dementia patient, they don't want like a full meal portions because they feel like overwhelming. So I will change her diet to a small portion and I will offer her the favorite food that she wants, because the most important point for this patient is that she needs to get food. If the patient presents problems with chew on another symptoms of her dementia, the diet will have to change it from regular to a pure diet, and this will change because of her mental illness, unfortunately. And I will have, well, and her daughter or any nurse can hand feeding and drink feeding to her, because as we mentioned, dementia is really hard to them. So if she already refused to deal with the IV feeding, imagine in the future she will maybe harm herself to remove the IV feeding. So probably I will agree to change her diet, but I will be checking on her each time, trying to make or give her a lot of options for her health and how she can eat more food, or at least eat something, drinking something. That way her health will not be deplorable with the time. And that's it. I hope you like my presentation and I comply with all the requirements. See you soon.